So tonight we're going to be learning about the risk factors for lung cancer, who should be screened, and how the screening process works. I'd like to kick things off by introducing our speaker this evening, Dr. Kayla Davis. Dr. Davis is a pulmonologist at the Ascension Saint Agnes Lung Center and serves as Saint Agnes's Chief of Pulmonary Medicine. Dr. Davis graduated from the University of the West Indies Faculty of Medicine, completed her residency at the Memorial Hospital of Rhode Island, and is fellowship trained in pulmonary disease and critical care medicine from Stanford University. She has extensive experience in critical care medicine, pulmonary, and sleep medicine, and specializes in the early detection and diagnosis of lung cancer. And Dr. Davis is also joined this evening by Karen Rudnicki, who is a care navigator at Ascension Saint Agnes and works specifically with lung cancer screenings. So I'd like to welcome you, Dr. Davis and Karen, to our presentation this evening, and thanks so much for being here.
Thank you very
Thank
much,
you, Kelly.
Great. Now I'll turn it over to you, Dr. Davis, to go ahead and go through the presentation today.
Thank you, Kelly. Good evening, everyone. Thank you for attending our lung cancer screening webinar. November is Lung Cancer Awareness Month, and there's no better way to bring lung cancer awareness than discussing lung cancer screening. So I'm happy to get started with you guys. So it's a little bit about me and my contact information. As Kelly mentioned, I practice at Ascension Saint Agnes in our pulmonary department. So screening for lung cancer. Lung cancer is the leading cause of cancer deaths worldwide. While smoking is the most common cause for lung cancer, we're seeing more and more incidences of patients who are being diagnosed with lung cancer who are non-smokers. So approximately 20% now are non-smokers. The hopeful part is that we are beginning to see improvements in 5-year lung survival. But lung cancer remains the leading cause of death within the United States, leading cause of cancer deaths within the United States. So just wanted to go over some 2025 lung cancer facts. So it's estimated that 226,650 adults will be diagnosed with lung cancer this year. Fact, lung cancer is the leading cause of cancer killer of both men and women, and is the leading cause of cancer deaths in many ethnic groups. When you look at cancer deaths, as lung cancer dwarfs colorectal cancer, pancreatic, breast, and prostate. All of this underscores the need to get ahead with lung cancer, prevent it, and then diagnose it as early as possible. And as we are seeing with this growing percentage of patients who are being diagnosed with lung cancer that have never smoked, anyone can get lung cancer. So with lung cancer screening, we really are focused on the high risk groups. And the reason we do this is because with screening, we can't screen everyone. So what longitudinal studies have showed is we look at certain risk factors that predict the likelihood of developing lung cancer. Smoking remains the #1 risk factor for lung cancer. But exposure to radon has now become the second leading factor for lung cancer development. Exposure to secondhand smoke, exposure to cancer-causing substances. So we look at asbestos, arsenic, looking at these heavy metals. What's interesting is that when you look at the literature with vaping, sometimes you do get trace amounts of some of these type of metals when they look at the studies. But these are all potentially cancer-causing triggers. Having a personal or family history of lung cancer does increase your risk. Personal history of COPD and pulmonary fibrosis increases risk, as well as having any history of radiation therapy to the head and neck or chest or esophagus during the childhood or early adulthood. The slide here looks at radon. I mentioned this because we know about tobacco as being is the #1 cause for lung cancer. But radon is something that's being recognized more and more, and it's something that develops from the soil. So it contaminates homes. So if there's concern Oftentimes you don't think about it until someone's diagnosed with lung cancer and have never smoked, and you start looking for causes within the home. But think about screening. Newer homes often come with infrastructure in place and some drains to help mitigate radon buildup within the home. But it comes naturally from within the soil and breakdown of uranium, and it gets into homes that way. So if there are concerns or you think that there may be radon in your home, they do have home test kits that can be ordered, and then there are also professional services that can come in and do formal testing within your home, as well as formal mitigation to deal with it. So vaping, smoking, and lung cancer risk. I think this is a growing area that we're looking at as far as potentially increasing your risk for lung cancer. Um, there's not, these are all areas where we don't have a lot of definitive studies yet. So in regards to vaping and lung cancer, there is some suggestion with some studies that there may be a slight increased risk of lung cancer with vaping. But more recent studies have clearly showed that there's a definite increase in cancer risk for smokers who start to vape. You're seeing a significant percentage increase, even those who quit smoking and start vaping afterwards, or smoke and start vaping as well. There seems to be a cumulative risk that leads to much greater likelihood of developing lung cancer. So there are some risks associated with vaping. As far as vaping by itself being a cause for lung cancer or a high risk factor for lung cancer, those studies are still ongoing. Likewise, in regards to cannabis use, smoking and lung cancer, the link between cannabis smoking and lung cancer is conflicting, and there's nothing definitively established. But the concern being, though, that with smoking and exposure to the lungs of carcinogens or smoke, that there can be some increased risk. So these are different things that are now developing that we don't think of typically that may increase lung cancer risk. So the best prevention for lung cancer is avoiding risk factors. So we talked a lot about risk factors just now. So avoiding smoking tobacco, working in places that have exposure to certain gases, asbestos, those type of things can help reduce cancer risk. Regular exercise, healthy diet, those are things that help overall reduce your cancer risk. For those who have smoked, your risk increases with the number of cigarettes that you've smoked and how long you've smoked. Your cancer risk does improve, though, over time from your last cigarette. So there is a way out with quitting, and quitting at any age does lower your lung cancer risk. Why we screen. According to the American Lung Association, 80% of lung tumors can be detected with early screening, when lung cancer is the most curable. So that's the goal of doing lung cancer screening. We want to identify a high-risk group, and then by screening, the hope is that we will catch lung cancer at a much earlier stage where we can cure it, and change the curve as far as survival rates. So early screening can save your life or the life of someone you love. Oftentimes with lung cancer, you do not have symptoms at early stages. That's why lung cancer screening becomes really important. As far as screening criteria, there are certain criteria for which to get a lung cancer screening covered by your insurance. The criteria that I'm discussing here, being 50 to 80 years old, a history of smoking at least 1 pack a day for the last 20 years, or 2 packs a day for 10 years, and a current smoker or having quit within the past 5 years. Most insurance programs will cover lung cancer screening. Medicare has a slightly tighter criteria at 50 to 77. Other insurers may follow the U.S. Preventative Services Task Force recommendation, which is 50 to 80 years old. But most lung cancer screening is covered by your insurance, and that's why it is targeted at a high-risk group, and this is the screening criteria. So if you fall in this group, definitely consider getting a lung cancer screening test done and talking to your doctor more about it. So if you currently smoke, used to smoke, or have any of the lung cancer risk factors that we discussed, including occupational exposures, prior cancer family history of lung cancer, these increase your risk for lung cancer and is something where screening would be recommended. So talking to your doctor. Um, as I mentioned a few minutes ago, so Medicare does cover, as well as per the Affordable Care Act, insurance companies are required to cover lung cancer screening for those who qualify, per the U.S. Preventative Services Task Force guidelines, as I mentioned. And some insurers may choose to cover services for additional groups that fall outside of that, but by and large, there's a pretty strict criteria that they're looking at for coverage for lung cancer screening. So when you look at the eligibility criteria, a lot of it is based on cigarette smoking. So cigar smoking, vaping, cannabis use don't factor in as strongly at this point. I think as the data grows and literature grows, that'll become a stronger recommendation. But at this point, that would be a discussion between your doctor if you have really concerns about your health, to see whether or not they feel that a screening would be very helpful for you. So the reason why we talk so much about screening is that by catching lung cancer in its early stages, you're able to have much better outcomes. And because lung cancer is asymptomatic, it's hard to catch it at an early stage without screening. So for more advanced stages of lung cancer, patients may have cough, chest pain, shortness of breath, weight loss. The difference between a stage 4 patient, which would have a lot of symptoms, and a stage 1 patient who has none is maybe the difference of survival of 92% survival at 5 years, like with versus stage 1 versus someone who's stage 4, where survival may be much lower. This just gives you a pictorial representation of lung cancer and catching it at an early stage with stage 1 here on the here, and again on the right here, you're seeing stage 4 where lung cancer is already spread to the bone, to the liver, within the lung, at which time patients may have more symptoms, but also cure is no longer attainable. So on this graph, I don't mean to dive into the a highly scientific graph or anything, but I think what is really highlights that's very important is stage matters. Where we find or when we diagnose lung cancer, the stage matters. When we catch it at an early stage, as I was saying, for stage 1A or the early stage, where you can get up to 92% survival at 5 years, versus more advanced stages where we're seeing survivals for stage 3 and 4 that dip below 50%. Again, survival rates are improving with newer therapies. Some of these Kaplan-Meier curves are a little dated in that way, and hopefully we're going to be seeing even more improvement with more advanced stages. But this is the reason why we screen, is that we really want to catch things at a stage where we can have a much bigger impact and a much better outcome. So what's involved in doing lung cancer screening? It's a low-dose CT scan that's performed. It's a non-invasive test. Basically, you'll be lying in a bed that moves into what looks like a donut. You're not enclosed, so there's no worry about claustrophobia. The entire process from check-in to completion should be less than half an hour. And this gives you a pictorial representation of the CAT scan. So you're seeing the donut that I mentioned, and basically you'll lie in the bed. It'll move through the donut. You'll be asked to hold your breath for a second or two, and that'll be it. So it's a very quick study, and it gives us a lot of information about the lungs. So what are the next steps? So if the lung cancer screen test looks good, and there's no evidence of any lung cancer, depending on your age and the years you'd quit smoking, you continue to get annual lung cancer screenings, continue to monitor or screen for any lung cancer. But what are the next steps if there's something abnormal? So if there's lung nodules that are concerning, depending on the size, location of the nodule, there may be a decision to biopsy. A biopsy will determine whether the nodule is due to cancer or sometimes it's due to another cause. The majority of lung nodules are benign, but there's certain features that would make us more concerned for lung cancer, where the screening becomes very helpful. So again, this just gives you an idea of catching things early. So this is stage 1 here on a CAT scan in the patient's lung, and here is a stage 4, more advanced stage of lung cancer. So additional testing may also be ordered as a next step to better characterize the nodule and determine if there's a high likelihood of cancer, and determine whether more invasive testing is needed. If nodules are too small or in a very difficult location, your doctor may decide to monitor closely, and imaging may be repeated anywhere at 3 months, 6 months, or even 1-year intervals, depending on the concern regarding the nodule. This just gives you a picture of the different interventions that may be done to evaluate the lung nodules. The hope with lung cancer screening is that we diagnose as early as possible, that we get the best outcomes. The good news is that the number of new lung cancer diagnoses is in steady decline. And this is multifactorial, whether treatment, decreased smoking rates, improved treatments. Hopefully we will continue to see dramatic improvements in declining and improvements in mortality rates. So prevention, the best prevention for lung cancer is to avoid exposure to tobacco smoke and other workplace substances such as asbestos and radon gas. We talked about exercise. I'm sorry. So quitting smoking is always a good idea if you're a smoker. Quitting at any age, do not believe that just because you're older and you smoke for so long, it's not going to make a difference. It does. Even your lung cancer risk as well as your overall health. I am going to turn over to Karen.
Okay. Thank you. So this year we're having our second annual lung screening day, which will be November 15th from 8 a.m. to 1 p.m. at Seton Imaging, the Ascension Imaging Center right here at Saint Agnes. And as Dr. Davis has discussed, if you meet the eligibility for screening, you're 50 to 80 years old, you've quit within the last 15 years or are currently a smoker, and you have a 20-pack year history of smoking or more, you'd be eligible and most of your insurances would cover it. But what's great about our lung screening is that maybe you don't meet all the criteria. Maybe you quit 20 years ago, but you're still between 50 and 80, smoked over 20 packs a year. What you could do is just pay a $60 one-time fee. We take credit cards, check, or money order, and you get no other fees besides that. You can do that and you can get a baseline, because a lot of people will call me, maybe they were exposed to the radon, as Dr. Davis had suggested, or again, they don't meet all the criteria, but they're still very concerned about, the possibility of lung cancer. We offer this not only on November 15th, but all year long. So you could call our 1-888-410-LUNG number, and I will get back in touch with you, do a brief interview over the phone. Dr. Davis provides all the orders. So on lung screening day, she will provide the order. You'll have the screening done. And then once we get the results back, Dr. Davis will review it, make her recommendations. I will notify you by phone and then also send you a letter with the results, as well as your primary care provider. This way, your provider can also have that as part of your medical records. And again, if you can't make it on November 15th, you can go anytime during the year. But again, you want to contact me first so we can go over some questions about your, if you have any of the risk factors, and then we'll also need to provide the order. Okay. Next slide. Another thing that is offered through our St. Agnes Cancer Institute is ProAct Lung. It's a study that they're doing now where when a person is going in for a lung screening, prior to the screening, they have lab work done. That lab work is then done again the following year and a year after. So they contact you in 1 year after it's first done and then the second year. And the lab draw has to be done before the screening. And they're trying to look at eventually if they would be able to pick up cancer through blood work prior to going for a lung screening and see if there's any correlation. And if you wanted to be part of that when you call for the screening, I can also give you some information and then pass on your name to our cancer specialist, and then they can contact you as far as being part of the study. And besides a blood draw before your screening, they also provide a stipend, so you also get paid for this each time you come in and have the lab draw. So that's something you can consider as well. Okay, thank you.
Thank you, Karen. That's a lot of good information. So I know we went through a lot of information quickly about regarding lung cancer screening, why we do it, what the hopeful outcomes are, and how Ascension Saint Agnes is committed to improving lung cancer treatment and awareness. So please let us know if you have any questions that we can try and answer at this time. I'm not sure if we have any questions in queue yet, Kelly.
We do, yeah. Thank you very much. That was some great information. We do have some questions coming in, as well as a few questions that were submitted in advance of our webinar tonight. So again, for everyone on the call today, just go ahead and submit those questions using the Q&A box. We don't have audio enabled for participants, so if you raise your hand, we won't be able to call on you or anything. So please do use that Q&A box, and we'll start going through some questions. All right, so Dr. Davis, you went over a lot of criteria for who should be screened. If someone has a family history of lung cancer, does that influence their need to get screened, and does that make them more susceptible to being diagnosed with lung cancer?
So family history does increase your risk for increase the risk or likelihood of you having lung cancer. So it is something that's factored in. That doesn't mean that all insurances will definitely cover your history of lung cancer as a reason for lung cancer screening. But there is a known risk and association. Again, what happens with the insurers when they establish their criteria, it's not even just it's the insurers, it comes out of studies, because really what the studies are hoping to accomplish is really pick out the patients that are most likely or highest risk for lung cancer. And by committing to taking an annual CT scan of the chest to screen for it, we can reduce the likelihood and catch the lung cancer early. The other side of it that I didn't talk about a little bit earlier, but I should still talk about now, is that the reason why we really target the high risk patients is because in those patients, when they've done studies, what they found is the risk of radiation exposure from the CAT scan. Now, we use low dose CAT scans for these studies, which have a very, very low rate of radiation, much lower than a standard CAT scan. So we use that. That's what we use for screening. So we try to reduce that risk as much as possible. But in a high risk person who's getting that every year, the cumulative risk for developing another cancer related to that, as far as risk benefit ratio for a high risk person, it's actually better for them to do that CAT scan each year, just because there's such a benefit in reducing their risk for lung cancer that it's worth it. But for patients who don't have a lot of risk, we don't want to be scanning them all the time. So that's because there is risk to that radiation exposure. So that's why a lot of the criteria are developed. But as I had mentioned at different parts in the talk, we're growing in our awareness of what drives lung cancer. So we know certain things. We know smoking. We're having better understanding with radon. We know that family history does factor in. We know certain exposures do factor in. I think talking with your doctor becomes really important and expressing your concerns about your risks and getting that CAT scan done. And being able to take a look and make sure that there's nothing happening at an early stage.
Wonderful. Thank you. That was very helpful. So in regards to patients who have been smokers in the past, but now use Nicorette gum, this particular question, this person has been chewing Nicorette gum for over 20 years. But does that have any impact on your eligibility for scans or your whether or not you should be screened?
So the Nicorette gum exposure itself is not going to increase your risk for lung cancer. I think what's probably more important is that if that's really worked and kept you smoke free for that time frame, I think that it's probably helped you a lot in that way, because quitting smoking does make that much of a difference. But no, that does not affect eligibility. And to my knowledge, long-term use in that way does not impact on lung cancer risk.
Perfect. And if a patient has asthma and uses albuterol, will that increase their likelihood, their risk of lung cancer?
No.
Um, can a chest X-ray pick up lung cancers?
It can, and but it'll pick it up at a more advanced stage. I think the best analogy is to think about an old black and white TV as far as a chest X-ray is concerned and the images you get versus like a high definition TV and the images you get from a CAT scan. It just gives you so much more. It just gives you so much more information on what you're seeing. So that the chest X-ray, it does pick up, but it'll pick up more larger lesions. The CAT scan allows us to pick up a lot more subtle disease. So it's a lot, it definitely is a better tool.
Perfect. We have a few questions regarding the screenings themselves and scheduling. Um, this first question, this patient has a CT scan scheduled for heart testing on the November 29th. Would November 15th be too close to have a lung CT scan?
That shouldn't be a problem. Clinically, that shouldn't be a problem as far as the scans are concerned. They're done for different reasons. So if you're meeting, so and the thing is that what I'm think you're getting done as far as a cardiac CT or cardiac calcium scoring, it does give us a look at some parts of your lungs. So sometimes it can sometimes pick up a nodule or if there's something happening in the lung, but does not give us a full view of your lung. So if you have risk factors specifically for lung cancer and are eligible for screening, I would definitely recommend getting the lung cancer screening and the formal CT done. It's not going to be a conflict in taking it that closely together. But as Karen mentioned earlier, we do have other dates available that you can schedule as well if you don't want it to do it that close.
Perfect. And for the screening day on the 15th, is an appointment necessary or do you take walk-ins?
We will take walk-ins, but if you could call ahead of time, I could get a brief history and I can have Dr. Davis have an order ready for you so that when you come in, we can give that to the staff at Seton Imaging. So it does help. And then I'll have all your information in our records so that when we call you with the results, we'll have that all ready. And then this way we can schedule people kind of separated apart for that day so that we don't get, everyone walking in at 8:30. So it does help.
Perfect. And Karen, you'd like for people to call the 1-888-410 lung number in advance?
Yes, that would be helpful. Yes.
Um, this person already has a lung screening appointment. How do they arrange for the lab draw?
Oh,
They can contact me and then I will call the coordinators down in the Cancer Institute and they will call patients. You have to meet certain criteria to be a part of the study. So they will also interview you over the phone and then see if you're eligible to go through with the study. So you can call the same 1-888-410 lung number and I'll get that message as well.
Great. Thanks, Karen. Um, mm, mm, mm. Okay, and this next question is asking about scheduling a test. So you can call this number right on the screen here and talk with Karen about getting your appointment set up. Um, Okay, so this next question is regarding radon. Is it accurate that insurance won't cover a lung cancer screening if radon is found in houses in your neighborhood?
Certain about that regarding insurance is not covering it. I think the thing is that if you're expressing concern because you've had exposure or for whatever reason, you lived in someone else's house for a long time, but whatever reason you had the radon exposure, I think talking to your doctor about it, and I'm not, I can't speak to it right now. I'm not sure of the specific criteria as far as the number of years of exposure that an insurer will cover. But I think a lot of it comes down to if when you talk with your doctor, if the discussion, if they're concerned that there's a significant enough risk of exposure, oftentimes we will be able to get the the insurance companies to cover the CAT scan for it. Um, but I wouldn't think that they wouldn't cover the treatment or anything just because of the neighborhood that you're in.
Okay.
I'm not sure if
And
that's overlap with homeowners insurance versus health insurance, because that might be part of that question.
yeah, that's a good point. And we talked a little bit about family history of lung cancer specifically, but does a family history of like a throat or bone cancer play into this at all?
It can. It can. There's certain cancers that we see that run in families. And that's part of what we usually ask as far as a physical history and physical from a patient is really just trying to get the family history, because it does factor in. There's certain particular cancer types that we see that tend to run in clusters. So they may not be, you may see a lot of it in a particular family that like an adenocarcinoma. So they may have a number of lung cancer, breast cancer, different ones, but they're all adenocarcinomas. Sometimes you'll see that happening as well. But family history does matter, genetics, and because that's what family history speaks to is genetics, and genetics does factor into the likelihood of developing cancer.
Okay. Um, this next question comes from a person who has a diagnosis of a left lower lobe and right middle lobe. I'm sorry, I'm going to say this word incorrectly. Atecliasis?
Atelectasis, okay.
Thank you. Yes.
Okay.
In the spring of this year, was found during a routine MRI for calcium scoring. What would your opinion be on the next steps for this person?
They can have a pulmonary evaluation just to find to understand why it happened. What atelectasis is basically is that the lung isn't as fully inflated as as it should be. So oftentimes, losing weight, if the person's overweight, breathing exercise, actually helps open up your lungs more and helps address that. So doing a lot of those measures and then reevaluating to try and determine whether there's really a process causing the atelectasis, or is it just that you may have been hypoventilating at the time, um, or there are there may be other factors decreasing that lung capacity. So that's a more complex one. So I definitely think having a pulmonary consultation would be a first start, or seeing a pulmonary doctor, so someone can go over your CAT scan in a lot more detail. That description doesn't make me concerned automatically for lung cancer, um, but there are abnormalities there that should be explained, and there may be things that you can do from a preventative standpoint that can help improve things as well. So it'll be good to figure that out.
Perfect. Okay. This next question is a similar kind of, well, not similar case, but this person has a family member who has an elongated lung, and he's noticed that this person, when they get a cough or a cold, it seems to last longer. There's some family history of asthma and collapsed lung. Um, what would your recommendations be for a next step for this patient?
I would say that that'd be similar in just seeing a pulmonary person, because you need somebody that's going to look at your situation specifically. Yes, you have a family history, but try to figure out what risk factors or habits you have specifically that would increase your risk for pneumothorax or lung collapse or anything of that nature. So I think someone that can look at the history, but also your current symptoms, and try to evaluate that to determine what would be the right steps for you specifically. So that would be the recommendation. You'd have to check to see with your insurer whether you need to get a referral from your primary care first, because some insurance companies, some insurers do require that. But or otherwise you can just call and schedule an appointment with a pulmonologist.
Perfect. That was gonna be my next question for you, is if you needed that referral. Okay.
Also,
Um,
just one thing, Kelly, if they do send a referral to our office, to send their primary care's last office notes and any other testing that they've had. This way, one of our pulmonologists can review that before the patient comes in to see them. Okay.
Perfect. That's a helpful tip. Thank you, Karen. Um, okay, next question. Does smoking cannabis qualify for getting insurance to cover a lung screening?
No, not yet. It won't. That's so in the slide, so vaping without any history of tobacco use at all, and cannabis, both are in a category where there's some suspicion that there's association with lung cancer, but it really haven't had a lot of definitive, consistent studies. There's been some kind of mixed studies that's kind of dubious. So you have one will say one thing, the other says another thing, and about equal size, so it doesn't put you anywhere. So there's still a lot of active research happening now in that regard. So because there's not that definitive literature on it, study-wise, I'm not sure if you'll be able to get that. But I think the thing is that if you're just extrapolating years of smoking and that's how your doctor's documenting, the insurer will cover it because they do look at smokers and looking at it that way. But as far as just cannabis in and of itself, that's kind of part of the ongoing work now as far as research.
Great. Thank you for that insight. Um, what else could a lung screening find aside from cancers?
Awesome. So basically the CAT scan really gives you just a snapshot of your lung. It gives us a very good look at it. And so it does help screen for any cancer, if you have pneumonia, if there's any scarring in your lungs or fibrosis. So it gives a lot of information. We can see how if there's inflammatory changes or patterns that would suggest like a asthma or something of that nature. So it does give us a true picture of the lungs, which is very descriptive.
Excellent. Is the CT scan, is that done with or without dye?
No contrast. And all we're looking at, there's no contrast with it. When they do calcium scoring and those other types of CTs, they usually do use contrast, but for lung cancer screening, there's no contrast.
Okay, great. On an earlier slide, you outlined kind of those criteria for being eligible for a lung screening. Is it required that you meet all of those criteria? For example, if you're both age 50 and a history of smoking required for the screening?
Yes, yeah, it's like all three. You have to have all three criteria. So basically, the between age 50 to 80, the 20-pack year smoking history, and either currently smoking or quit within the last 15 years. Are pretty much the standard criteria that they're looking at. So again, some insurers, there's some wiggle room depending on, and then they may factor in family history, radon, all these other things that there are known associations with. So they may take that into account and cover the screening. But as far as a standard lung cancer screening, it's really those core three things you have to meet that criteria. So again, it's all based around tobacco. But again, we're recognizing that there are more things beyond just tobacco that can cause lung cancer. So I think we'll see more fluidity with that in regards to insurers over time as we start to get more data, because I think once studies can show strong associations between certain behaviors or exposures and cancer, then then they end up having to cover the lung cancer screening or the screening for that if you're exposed. So
But again,
uh,
that's criteria covered through insurance. If you don't meet all
exactly.
of that, you can just pay the $60 fee. So you may not meet any of their criteria, but you can just pay the $60 fee. She's referring to insurance coverage for that.
Excellent. Good point, Karen. Thank you. And it kind of along those lines, it ties into this, I think. This person, for example, has never smoked, but both of their parents were heavy smokers. and they lived at home until age 25, now in their 50s.
Mhm.
What does that have added risk for lung cancer?
It does. It's not as well studied, so that we know that there's a definite risk with secondhand smoke exposure, especially at a young age. And there was a generation of people that just grew up in smoky rooms. So, but I think it's understood. It's not formalized in the criteria, but again, those are things that you can talk to your primary care doctor about, um, and and be able to document the concerns and build a case for why lung cancer screening is necessary. Um, but I think that's definitely something worthwhile to talk to your doctor about.
Excellent. And then this last question we have in the chat right now is, can you still get screened even if you never smoked?
So I guess yes and no, in that we offer the service with the lung cancer screening really because we want our community to be one aware of lung cancer and the fact that catching it early really does make that much of a difference in outcomes. So we want to make those things available, and we realize that not everybody falls into the criteria that are high risk and don't fall into the criteria. So we want to make that available. But at the same time, we don't want to, if you have no risk at all, I guess a snapshot in time won't hurt, but it's what they had looked at over time was say is really cumulative risk with getting a lot of scans. So we wouldn't want to have to do a lot of different scans over a short period of time if you don't really have the risk for it. But we really are offering the service that Karen mentioned. So if you just really have a lot of concerns, you're hearing this information and you just need a point in time to make sure that you're not in that category of growing category of patients who are never smokers and are being diagnosed with lung cancer, we do offer a way, an opportunity for you to be able to get scanned.
Fantastic. All right, we got one more that just popped up. If a person does not want the radiation that goes along with the CT scan, would an MRI be a good alternative?
Technically, yes, but it's not something that we don't typically use MRI to screen for lung cancer. But it does not have that type of radiation that CTs do, and MRI does give us a very fine look at the lung. Um, Again, it's just not, it hasn't really been studied in that way to be used serially as a way of monitoring or screening for it. Um, but it would do the job as far as screening out and looking for it, or being able to evaluate and look and pick up any, if there's any lung cancer, it would pick it up because it will pick up very small lesions, as well as far as the imaging capabilities. But I think the CAT scan, the availability, and I don't know if it's just the volume that we've done with it. It just really is the workhorse of how we evaluate the lung is really the CAT scan.
And also, Dr. Davis, isn't the um, lung screening the lowest radiation?
It is, it
Pretty much,
is.
right?
It is. So it's it's like about it's several times less actually than a regular CAT scan. So I think or as far as order of magnitude. So it's a lot less, but the thing is it's still cumulative dosing over time, but then that's why we keep talking about high risk groups and really making sure if you have the risk, then it becomes worth it to take a look. If you don't, then it's really you're trying to balance the risks and benefits with radiation potential, even though low dose radiation exposure and potential cumulative exposure versus scanning.
And how often do you recommend, like if you meet the criteria and things like that, how often do you recommend getting screened? Is it a one-time screening and then you're done, or do you do it every so many years?
So there are different things you're talking about now. So the thing with lung cancer screening, usually as long as you fall into that same criteria, so you're age between 50 and 80, and depending on when you quit smoking, um, that would determine how long you'll be eligible as far as your criteria. So I have patients that kind of age out of it. So they screen annually. If we pick up something, we deal with it. But other than that, it really depends on your risk year to year. So for a lot of patients, they may get plugged in at 60 and they may have annual screens for the next 17 to 20 years. So it just really, so it is recommended annually, and that's when they looked at the cumulative risk and weighing the risks and benefits of it when they did the studies to recommend lung cancer screening. It still outweighed it. Even doing it every year like that, the benefit definitely outweighed any potential risk.
Excellent. Thank you for clarifying. It looks like that's all oh, okay. Sorry, one more. The number that's on the screen, the 410 lung number, is that a 24-hour available line, or are there particular hours that you should call to schedule?
No,
And go ahead and
go
answer
ahead.
that one part too.
Yeah, that's 24/7. And they have a recording where you can leave your name and phone number, and then I will contact you within 1 to 2 business days after I receive it.
Perfect. And if you're if you're planning to pay out of pocket for the test, you do not need a referral for that. Is that correct?
Well, but you need an order. So that's why I say call me. And this way, Dr. Davis will have an order ready for you, or I'll mail it to you. If you can't make it on the 15th, no problem. I'll mail it to your house and then give you the instructions on how to call. Because when you call, if you want to schedule an appointment, you have to let them know it's self-pay. Otherwise, they'll go through your insurance provider. And if you don't meet the criteria, they will say insurance has declined it. So it gets a little confusing. So either way, I'll send you an order, but we do need some type of order. You can't just walk into Seton Imaging to get it. You need to have an order because we need a provider that will review the results and know what to do as far as recommendations after we get those results.
And Karen, can you just give a quick high level what the difference is between a referral and an order, just to clarify?
Well, an order is like a prescription, like you would get for medication, a chest x-ray, things like that. A referral, if you wanted to come to a doctor's office, your primary care would send a referral with the office notes and the reason why they want someone to be seen.
Perfect. And so you can provide that order piece when people call this 410 number.
Yes, I'll talk to them, interview them, see what risk factors they have, or if they just want to get a baseline, they have, just a few risk factors. And that helps because then like I said, we can get them in our system and then have all their contact information available.
Perfect. Thank you for clarifying that. All right. I think that's all we have for today. Dr. Davis and Karen, do you have any final words before we wrap up for the evening?
A lot of great questions. I hope this was helpful for everyone. Definitely take advantage of the lung cancer screening day on Saturday. It's November 15th. But again, we're doing this year round. Ascension Saint Agnes is committed to lung cancer screening and trying to lower lung cancer rates. So if there's anybody that you know that is in that risk factor, in that risk category, or you're really concerned that they may have lung cancer or at risk for it, please, please, please get them a lung cancer, get a screening lung cancer screening CT scan for them, because that may save their lives. Thank you.
And thank you so much for your time today. So if you do think of any additional questions or you'd like to get more information about screening, again, you can call this number on your screen, 1-888-410-LUNG, or you can also find more information on ascension.org.